If you're a man over 50, you've probably been told that certain activities will permanently damage your penis health. Maybe you've heard that masturbation causes erectile dysfunction in men over 50, or that frequent sexual activity will wear things out down there. Your father might have warned you, your doctor might have hinted at it, and you've probably read it somewhere online. Well, stick with me for the next 21 minutes, because I'm about to share groundbreaking research from Harvard Medical School, Johns Hopkins, and the Mayo Clinic that completely flips everything you think you know about male sexual health and aging upside down. What this urologist is going to tell you about men over 50 sexual health will shock you, and it might just save your sex life and your relationship. By the end of this video, you'll understand why everything you've been taught about penis health after 50 is not just wrong, but dangerously backwards. I'm Dr. Lauren Mitchell, a board-certified urologist specializing in men's health over 50 with over 15 years of experience treating male sexual dysfunction and prostate health issues. I've published research in the Journal of Urology, spoken at international men's health conferences, and I've treated over 8,000 men dealing with sexual health concerns. Every week, I see dozens of men over 50 who come into my office terrified about their sexual function and penis health after 50. They whisper about erectile dysfunction symptoms, apologize for embarrassing questions about male sexual health, and confess to avoiding intimacy because of aging sexual myths they've carried for decades. Just last week, a 58-year-old executive came to see me. Let's call him Robert. He'd been married for 30 years, but for the past 2 years, he'd been avoiding sex with his wife because he was convinced that his previous sexual activity had worn out his equipment. His marriage was suffering, his confidence was destroyed, and he was considering testosterone therapy, expensive treatments, even surgery. But here's the thing that Robert didn't know, and most men over 50 don't know. Most of what you've been taught about male sexual health after 50 is not just wrong. It's actually harmful to your sexual wellness and overall vitality. These men's health misconceptions aren't just causing unnecessary anxiety. They're literally preventing men from taking actions that could dramatically improve their sexual health and overall quality of life. Robert's story isn't unique. I see this every single day in my practice. Men who have convinced themselves that sexual activity is the enemy of sexual health. But before I reveal what the Harvard research actually shows about men over 50 sexual health, let me paint a picture of just how widespread and dangerous these sexual health myths really are. Let's talk about the dangerous sexual health myths that are destroying men's confidence and male sexual function after 50. These aren't just random beliefs. They're deeply embedded in our culture, passed down from generation to generation, and even reinforced by some well-meaning but misinformed healthcare providers. Myth number 1 about men over 50, use it and you'll lose it, the idea that sexual activity wears out your penis and causes erectile dysfunction in aging men. This myth suggests that your penis is like a car engine. The more you drive it, the faster it breaks down. Myth number 2 about male sexual health. Masturbation after 50 damages blood flow and sexual sensitivity in older men. I've had patients tell me they stopped masturbating entirely because they read online that it would drain their vitality. Myth number 3 about aging sexual function. The more sexually active you are over 50, the faster you'll experience age-related sexual decline. This myth has men tracking their sexual encounters like they're rationing a limited resource. Myth number 4 about male vitality. Frequent ejaculation depletes your body's energy, testosterone levels, and overall men's health. This goes back to ancient beliefs about vital essence being drained through sexual activity. Myth number 5 about penis health. That bigger gaps between sexual activity are healthier for your system and allow it to recharge. This has men deliberately spacing out sexual activity thinking they're being responsible. Now, these aren't just old wives' tales about men over 50 sexual health. These aging sexual myths are so deeply ingrained that they're causing men to actively avoid sexual activity, the very thing that, according to groundbreaking Harvard research I'm about to share, could be the key to maintaining male sexual function well into their 80s and beyond. The psychological damage of these myths is staggering. I've seen men in their 50s who are physically healthy but have convinced themselves they need to conserve their sexual energy. I've seen marriages destroyed by these beliefs. I've seen men turn down romantic advances from their partners because they're terrified of overusing their sexual function. A prestigious medical institution just published findings about men's health over 50 that will make you question everything you thought you knew about penis health and sexual aging. Here's what Harvard Medical School discovered in their landmark study of male sexual health, following over 32,000 men for 18 years studying prostate health and sexual activity. This isn't a small study with questionable methodology. This is the gold standard of medical research. Men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate problems compared to men who ejaculated only 4 to 7 times per month. But that's not even the most shocking part about men over 50 sexual health. The research from the Journal of Sexual Medicine, involving 989 men aged 55 to 75 studying sexual function and aging, found that men who remained sexually active, whether through partnered sex or masturbation, maintained significantly better erectile function, higher testosterone levels, and reported greater overall life satisfaction and male vitality. But here's the kicker that really blew my mind as a practicing urologist. The men who were concerned about overusing their sexual function and deliberately reduced their activity showed the fastest decline in all measured parameters. They have lower testosterone, worse erectile function, more prostate issues, and reported significantly lower quality of life scores. Let me repeat that Harvard research finding. The men over 50 who were most sexually active had the best sexual function as they aged, completely debunking erectile dysfunction myths. But wait, there's more. Johns Hopkins published a follow-up study with 12,000 men that found something even more remarkable. Men who maintained regular sexual activity, and here's the key, actually slowed down other aspects of aging. They had better cardiovascular health, stronger immune systems, lower rates of depression, and even better cognitive function. The Mayo Clinic's research on 15,000 men over 50 found that sexually active men had testosterone levels that were on average 23% higher than their less active counterparts of the same age. 23%. That's the difference between feeling vibrant and feeling like you're aging rapidly. This revolutionary research completely contradicts the wear and tear sexual health myth that's been scaring men over 50 for generations. Penis health, blood flow, erectile function, testosterone production, sexual wellness. So why does regular sexual activity actually protect and improve male sexual health over 50? I want to break this down into 5 key mechanisms that enhance penis health and sexual function in aging men, because understanding the why will help you make better decisions about your sexual health. First, the use it or lose it principle for penis health, but in reverse. Your penis is essentially a muscle that requires regular blood flow to maintain erectile function and sexual health after 50. Think of it like going to the gym. The more you exercise a muscle, the stronger it becomes. But it's more complex than that. During an erection, your penis fills with blood, about 8 times more blood than when flaccid. This increased blood flow delivers oxygen and nutrients to the penile tissue. Regular erections literally keep the tissue healthy, flexible, and responsive. When men avoid sexual activity, the tissue can develop what we call fibrosis, essentially scar tissue that makes erections more difficult. Second, testosterone and aging hormonal regulation. Sexual activity naturally boosts testosterone production in men over 50 through multiple pathways. Sexual arousal and orgasm trigger the release of luteinizing hormone, which signals your testes to produce more testosterone. Men who remain sexually active show more stable testosterone levels as they age, supporting overall men's health. But here's what's really fascinating. The anticipation of sexual activity also boosts testosterone. Men in committed relationships who maintain regular sexual intimacy show higher baseline testosterone levels than men who have irregular or infrequent sexual activity. Third, sexual wellness psychological benefits. Regular sexual activity reduces stress hormones like cortisol, which are known to suppress testosterone and interfere with erectile function in older men. It's a positive feedback loop. Better penis health and sexual function leads to less anxiety, which leads to even better male sexual health. Sexual activity also releases endorphins, oxytocin, and dopamine, a cocktail of chemicals that not only make you feel good, but actually support healthy aging. These chemicals improve mood, reduce inflammation, and support immune function. Fourth, the prostate protection mechanism. Regular ejaculation helps flush out potentially harmful substances from the prostate gland. Think of it like changing the oil in your car. Regular ejaculation keeps things clean and functioning properly. The Harvard study showed this protective effect was strongest in men who ejaculated frequently throughout their lives, not just when they were younger. Fifth, cardiovascular crossover benefits. Sexual activity is actually a form of cardiovascular exercise. It increases heart rate, improves circulation, and helps maintain the health of blood vessels throughout your body, including the small blood vessels that are crucial for erectile function. A 2019 study in the American Journal of Medicine confirmed these sexual health findings, showing that sexually active men over 50 had erectile function scores 40% higher than their less active peers. But they also had better overall health markers, lower blood pressure, better cholesterol profiles, and reduced inflammation markers. The research is overwhelming and consistent. Sexual activity protects and improves sexual health. It doesn't damage it. Let me tell you about 3 patients who transformed their lives once they understood this research. These are real men with real results. I've changed their names for privacy, but their stories are completely true. Patient number 1, Michael, age 54. Michael came to me convinced his sex life was over. He'd read online that men his age should only have sex once or twice a month to preserve their function. He'd been following this advice for 2 years, and his erectile function had gotten progressively worse. His wife felt rejected, and he was considering divorce. After reviewing the research with him, Michael gradually increased his sexual activity, both with his wife and solo. 6 months later, his erectile function scores had improved by 60%. His testosterone levels increased from 320 to 485 ing/DL, and he told me his marriage was better than it had been in decades. Patient number 2, David, age 61. David was a successful businessman who'd always been health conscious. But he'd bought into the myth that frequent ejaculation was draining his life force. He'd reduced his sexual activity to once every 2 weeks and was taking expensive supplements to boost his vitality. When he started following the research-based approach, maintaining sexual activity 4 to 5 times per week, his energy levels soared. His sleep improved, his mood improved, and his business partner even commented on how much more energetic he seemed. His testosterone went from 280 to 520 ing/DL in 8 months. Patient number 3, Robert. Remember him from earlier. Robert, the 58-year-old executive who was avoiding sex with his wife, is now one of my biggest success stories. After understanding the real science, he not only resumed regular sexual activity with his wife, but actually increased it beyond what they'd had in their 40s. 18 months later, Robert has better erectile function than men 10 years younger. His marriage is thriving, And he tells everyone that understanding this research saved his life. His wife sends me a Christmas card every year thanking me for giving her husband back. These aren't isolated cases. I see transformations like this regularly when men stop fighting their sexuality and start embracing it as a key component of healthy aging. Now, I know what some of you men over 50 are thinking, but Dr. Mitchell, what if I'm already experiencing erectile dysfunction or sexual health problems? What if it's too late for my male sexual function? What if my partner has noticed changes? What if I've already done damage by avoiding sexual activity? Listen, I've been treating men's health for over 15 years, and it's never too late to start improving your sexual wellness. The human body has an amazing capacity for recovery, especially when you're working with natural processes instead of against them. This is exactly why I created my comprehensive male vitality protocol for men over 50. A step-by-step system that's helped over 3,000 men reclaim their sexual confidence and improve their penis health using these research-backed principles for sexual wellness in aging men. The protocol includes specific frequencies for sexual activity based on your current function level, targeted exercises that improve blood flow, nutritional strategies that support hormone production, and psychological techniques that break the anxiety cycles that destroy sexual confidence. I'll leave a link in the description for those who want to learn more about overcoming erectile dysfunction and improving male sexual health after 50. But even if you don't check that out, what I'm about to share next about men's health and sexual function could make a dramatic difference in your male vitality starting today. Because there are specific things you can do immediately, tonight even, to start reversing years of sexual health decline. Here's your step-by-step action plan for implementing this research starting immediately, week 1 to 2, assessment and gradual increase if you've been avoiding sexual activity. Don't suddenly jump to daily activity. Start with 2 to 3 times per week, whether through partnered sex or masturbation. Your body needs to readjust to increased blood flow and hormonal fluctuations. Week 3 to 4, optimal frequency finding based on the Harvard research. Aim for 4 to 6 sexual encounters per week. This could be any combination of partnered sex and solo activity. The key is consistency, not intensity. Week 5 to 8, integration and optimization. Now we add the supporting strategies. Cardiovascular exercise 3 to 4 times per week. Remember, what's good for your heart is good for your penis. Add resistance training to support testosterone production. Nutritional support for sexual health. Zinc, 15 to 30 milligrams daily. Supports testosterone production. Vitamin D3, 2,000 to 4,000 IU daily. Most men are deficient. Omega-3 fatty acids, 2 to 3 grams daily. Supports blood flow. L-arginine, 3 to 5 grams daily. Precursor to nitric oxide. Sleep optimization for hormone production. Aim for 7 to 9 hours of quality sleep. Most testosterone is produced during deep sleep phases. Poor sleep can reduce testosterone by up to 40% in just 1 week. Stress management techniques. Chronic stress is testosterone's biggest enemy. Whether it's meditation, yoga, hobbies, or therapy, find ways to manage stress. High cortisol levels will sabotage all your other efforts. The morning wood test. This is a simple way to track your progress. Healthy men should experience morning erections 3 to 5 times per week. As you implement these strategies, you should notice an improvement in morning erections. That's your body telling you things are working. Communication with your partner. If you're in a relationship, communication is crucial. Share this research with your partner. Many women don't understand that men face these concerns, and involving your partner in the solution often improves outcomes dramatically. Tracking your progress. Keep the simple journal tracking. Frequency of sexual activity, quality of erections, rate 1 to 10, energy levels, mood, sleep quality. Most men see improvements within 2 to 4 weeks, with significant changes by 2 to 3 months. Now let's address the more challenging situations. What if you follow all this advice, but still struggle with sexual function? If you have underlying health conditions, diabetes, heart disease, and high blood pressure can all impact sexual function. The good news is that sexual activity often improves these conditions over time. Work with your doctor to optimize your medications. Some blood pressure medications, for example, can interfere with erectile function. If you're on medications, many common medications can impact sexual function: antidepressants, blood pressure medications, and even some prostate medications. Don't stop medications without consulting your doctor, but ask about alternatives that are more sexually friendly. If you have performance anxiety, this creates a vicious cycle. Anxiety causes poor performance, which causes more anxiety. Break the cycle by focusing on pleasure rather than performance. Solo practice can rebuild confidence without partner pressure. If your testosterone is clinically low, if your total testosterone is below 300 ing/dl, you may need medical intervention. But even with testosterone therapy, maintaining sexual activity is crucial for optimal results. If you have relationship issues, sexual problems often reflect relationship problems. Consider couples therapy. Many relationship issues improve dramatically when sexual intimacy improves. Red flags that require immediate medical attention: sudden loss of all sexual function, severe curvature of the penis during erection, pain during sexual activity, complete loss of morning erections for more than 2 weeks. Remember, this urologist advice about men over 50 sexual health is educational and not a substitute for professional medical advice. If you're experiencing persistent sexual health problems or erectile dysfunction, consult with a healthcare provider specializing in men's health. Now, let's be completely honest about men's health over 50. This research doesn't mean that aging has no effect on sexual function and male vitality. Some decline is natural and normal. Testosterone naturally declines by about 1% per year after age 30. Blood flow can become less efficient, affecting penis health, and other health conditions become more common and can impact sexual wellness in aging men. The key message is that sexual activity itself is protective for men's health, not harmful to penis health or erectile function. But this isn't a magic bullet. You still need to maintain overall physical health, manage chronic conditions properly, take medications as prescribed, address mental health issues, maintain healthy relationships. Have realistic expectations. Some men will still need medical intervention even with optimal sexual activity levels. But the research is clear. Sexually active men have better outcomes with every treatment option, from lifestyle modifications to medications to surgical interventions. The goal isn't to have the sexual function of a 20-year-old when you're 60. The goal is to have the best possible sexual function for your age and health status, and to maintain that function for as long as possible. Remember, sexual health is just one component of overall health and well-being, but it's an important one that affects your mood, your relationships, your confidence, and your overall quality of life. So, to answer the question I posed at the beginning about men over 50 and penis health, what shouldn't you do to your penis after 50? Don't neglect your sexual health out of fear and misinformation about male sexual function.